Sarah. Thank you for joining me today. I'm very excited to have this conversation because I think that your perspective is going to be really interesting to our community. So I would love if you could share a little bit more about yourself and who you are, and then we can get into why you're here.
Thank you so much for having me. It's really a pleasure to be here. My expertise, as you know, has come from my own lived experience as a patient, largely. But I'm very lucky that that expertise also includes several years as working as a specialist. So I am a pediatric ABP board certified in general pediatrics physician who specializes in hypermobile Ehlers-Danlos syndrome. I do see the other types of Ehlers-Danlos but I'm also specialized in caring for the conditions that tend to go along with it. And that is a complex swirl of conditions. And until recently, we really didn't appreciate how many body systems were involved in this connective tissue disorder specifically.
Yeah.
So it's really a privilege and an honor to be able to use what I have learned as a patient, in addition to what I've learned as a physician, to really optimize care.
Yeah. And that I think, when I first connected with you on social media, that was what drew me into your content, is because it's so different than your average physician content. We share largely personally, professionally on social media. And, when you can blend some of that together and really make that content understandable for both patients and providers, and just as a general audience, to make something that can be inherently very complicated and very difficult to understand from either or both perspective, it's really refreshing to be able to have that information in a way that even like myself, who does not have EDS, but I do understand where those complications come in. I have a general understanding of it because of our patient population, but to really understand some of the additional barriers that those patients face in such a easy way to understand is just really great. And I know your content has gotten a little bigger in the last few months, which is great to see, because that means that you're doing something that is really making a difference. And that's just so
Thank
wonderful.
you. I'm having a great time with it. It's really fun. Anybody who knows me knows that succinct speaking is not my forte. So it's actually also been an exercise in condensing my thoughts so that they are accessible. Because the
I
algorithm
understand that.
videos, right? I would rather go on at great length, but one of the things
Yep.
that's particularly exciting about it is being able to share a detailed and accurate information with a lot of people, not just the people right in front of me, and that's extremely
Yeah.
important to me as well. But I think what people if they haven't been in the room, they underestimate how scary it is and how much your brain turns off when you're in with the physician or the clinician that you've been waiting months
Yeah.
and months to see. So having been that patient both before, during, and after medical training, and I'm telling you, when I sit with a new physician myself, I still have to sit there and be like, okay, brain, nope, you know this information, you're just going there. It's okay. And it's scary. So, we have to understand that if you don't have that background, how much more scary it is. So, I'm
Yeah.
always telling families to make sure that they have, pen and paper, have an advocate there with you. But I really love being able to tap into that side of my life experience in order to make this information more accessible. It's really important
Yeah.
to me.
Yeah, it is. And social media content, like, as just a consumer of content, right? Like, I see people doing stuff and I'm like, wow, they're so good at that. It's like, it must be so easy, or come so easy to them. And then you try to do it and you're like you said, it's so hard to sometimes stop talking, because I don't know about you, but me, when I start like overthinking something, I can't shut the hell up, and it just keeps coming out. And then I'm like, I don't even know if any of this is understandable anymore. Sorry, guys. I hope you got
Yeah.
my point. But it's just, really interesting to see how there's been such growth and change in the type of content that our lives, right? Where our lives intersect to to see the growth and to see the changing and how people share content. You know, it went from being super informational for so long that there was a lot of dry content out there. It was great content, but it was
Yeah.
dry, you know, things that you scroll past. And then it kind of went the complete other direction where people were just doing like funny dances with this information, right? And so it would like pop into
Yeah.
your algorithm. And
Yeah.
now I feel like there's a really nice blend of both of those things to
Yeah.
where you see more of the human side of the physicians and the experts too. And that is really something that I love to see because we forget that our physicians are also just regular people too. Like you have this experience, you have this knowledge that we don't have. And
Mhm.
a lot of us put our lives in your hands, you know, to say, please help me. But to really
Yeah.
see, you know, a little bit more of the down to earth kind of content is really, I think it just seeing that relatable bit makes us want to consume more of your content and then
It's
we get
true.
to learn something out of it. So it's a nice back and forth relationship.
I really appreciate that. I think that was also part of what motivated me to do this because I was getting, and this is so meaningful to me, especially I receive a lot of comments and interest both from patients and from people who see my content online that that they are struggling with either the same or similar chronic illness situations and
Hmm.
want to know how they can get through and get to medical training like me. And I say it like that because I'm like, it was not smooth sailing. It was not, here's the starting point, here's the ending point. And the last thing I would ever want is, there's this phrase that I hope this is okay on your podcast. There's something called inspiration porn,
Hmm.
and I think there is a place for showcasing what humanity can do and do well under difficult circumstances. But when we turn people who have had hardship or people whose bodies do not fit the stereotypical norm and say, "Oh, look what they can do," it's
Yeah.
dangerous and. For several reasons, but largely for these individuals, I don't want them to look at this path and say, "Oh, because she can do it, I can do it and it won't be a problem." But I want
Yes.
people to understand what goes into, and just not to demotivate anyone listening, by the way, that's not the message here. The message is that you might need different things than the person sitting next to you, and that's okay.
Yes.
I don't want
Yes.
someone to look at my content and say, or actually, especially parents, to say, "Oh, well, my kid is suffering now, but that physician has figured it all out. Everything's fine. We're going to have a golden future. And therefore, I should show this to my kid, and my kid will be motivated and okay." No, that is
No.
not the point of the content. The point of the content, when I talk about the journey part, is to understand how to do it step by step so that it is less difficult for you than it was for me. Um,
Yes.
yeah. Yeah, and
Yeah.
and that's a lot, and it's a little cathartic for me as well, because it was not always an easy journey, and I do really value what I learned from it so that others can have an easier time doing that too.
Yeah, and saying that it's very similar to a lot of the, inspirational stories that we want to share. I want to show you how we did something, but to your point,
Yeah,
like I don't want you to think that it's easy and I don't want you to think that your journey is going to mimic mine just because we might have similar conditions or similar issues or maybe even a similar journey, right? And it's more so to break it down to say, yes, I was able to do this, but like let me show you how I did it. And when I
yeah,
hit a certain barrier, this is what I did about it or this is what I didn't do about it because that's realism. That to me
mhm,
is the inspiration. I don't want to just see that somebody was able to run all the world majors, and they were able to get to the like Paralympics if we're talking about our disabled people that are part of our community that
right,
are able to do these amazing things and it is truly inspirational and you like you said you don't want to take away from that
mhm,
but you also want to see like what happened when it hurt?
right,
Right? Like, what happened? What did you do when it got hard? And there are
exactly.
times where I'm like, I did nothing. I sat there and gave up for a little while, but
I
that's the
I
real story.
deliberately told myself that this weekend was a nothing but gentle, like, reading. I have
Yeah.
a puzzle out, I have an audio, but, like, nothing other than deliberate, intentional rest, and that's hard for me, and I texted a friend about it being like, "Alright, I'm trying to remember that all rest is good rest and we can do it on purpose
Mhm.
because it's hard. We don't live in a culture that
Yes.
values that. And that's a problem.
Yeah.
But
Yeah.
we're also very bad at individualizing what people can accomplish and that's okay. It's sort of like either
Mhm.
you're the Paralympian or you're, a drain on society. And that's horrible. We need to have
Yeah.
nuance and individuality in what people experience and what they can accomplish. And with that, there's nothing wrong with accessible accommodations. That is important, and that
Yeah.
the fact that we don't value that as a culture is just horrible and heartbreaking.
Mind-boggling.
So,
Yeah. I know that messy middle, it's a messy
yeah,
middle for a reason. It's not easy to be in. It's not easy to live in, but it's
yeah,
the one that we exist in. And I think because we don't fit in those typical boxes,
right.
I say a grand they, like there's all these people, but it's like
Yeah.
it's easy if you fit, a square into a square hole or a circle
Mhm.
into a circle hole. And I know from my own patient journey that I felt like the square peg trying to be shoved into a circle hole this entire time where I'm like, I don't fit in this space. Stop trying to put me
Yeah.
over here. Or if you don't fit typical guidelines of a diagnosis, right? But that doesn't change the diagnosis. It just means that there are other things going on. Is that maybe if you don't check all the boxes, maybe that's not your diagnosis, but it
Yeah.
doesn't always not mean it's your diagnosis because people
Mhm.
present differently. And I
Mhm.
think, given your experience as a patient and working with patients, that's something that you have, like, as a magic power, right? Over the physicians and the people
Yeah.
that don't understand that experience. So when people are hitting those barriers, even if you don't have an answer, there is that understanding of what that feels like that I can
Mhm.
imagine that your patients, the families of your patients really where you can make that connection differently than the average physician can.
Thank you. I really appreciate that. I think it, it's tremendously meaningful. I remember being a teenager, very lost and very confused, and saying, I don't really fit the boxes that you're trying to put me into. And I don't
Mhm.
know why, and it was very frightening. So, yeah, if I had had a physician who got it, I think it would have changed a lot. I felt very alone until, um, at least partially through training. I was very lucky that the residency that I was at, I had other, remarkable people there with me who had a smattering of different disabilities, and I think that's why I wound up there as well. It was the residency was connected to where I went for medical school, so the residency
Okay.
director knew me a little too well by that point because medical school took me 6 years, instead
Mhm.
of 4. He'd seen me struggle, he'd seen me get back up, repeatedly, and still said, "Yeah, I think we should take her." So I knew that there was some inherent safety in that environment, and the first person
Mhm.
who sat down next to me at orientation, was, in a wheelchair. So we obviously instantly hit it off and became a pair of like, "Okay, how are we gonna ask for this accommodation? What are we gonna do with this?" And it was so
Yeah.
valuable to have someone else right there. So I can only imagine what it would have been like to have a physician who'd been like us. Um, and she remains one of my dearest friends. So,
Mhm.
that kind of connection is indisputably powerful. But also I think I was very, very lucky in growing up with a culture and just community that was very interested in questioning things. So if something didn't fit perfectly, you asked a question and you figured it out. That was how I was raised. That was what was valued. And so for me, I look at medicine as this still ongoing unknown. And so when
Mhm.
someone is sitting in front of me and it doesn't tick off the boxes, I don't say, well, darn, you can't have any of those things. I say, well, shame we don't know everything yet. Let's see what we can do to make it
Yeah.
better. So, because I'm,
Mhm.
I'm always fond of saying that at every single point in history, medicine has said, we know what we're doing now. Always. At
Yeah.
every point in however long we've existed and had medicine. Um,
Mhm.
and if we continue to think that way, that is what holds us back ourselves. So let's look at it with more curiosity the way we're supposed to as physicians. And I think because of my own lived experience, it really drives that curiosity and that unwillingness to say, we know everything now. If it doesn't fit all the boxes, it can't possibly be XYZ. No, we continue to evolve and learn more and more and more.
Yeah. It's interesting how in the last year or so, the most like the topic that has come back has always been to stay curious. And it's
Mm.
interesting because it's across all different conversations, and it's something that I've obviously picked up on and really, thought about myself, where I'm like, well, why? Like, really trying to think about that. Like, well, why am I
Yeah.
thinking this way? Or how did that happen? It's like you just really want to keep asking questions. And
Yeah.
there are a lot of times where, as a patient, where I get to a point where I'm just so burnt out. I'm like, I don't even have the energy. I don't have the energy to think of a
Yeah.
question, ask a question. I don't want to do nothing right
Mhm.
now. And we've all gotten to that point. But I think that
Oh, my
in a
God.
lot of ways, it's right. It's because like, we've been solely responsible
Yeah.
for that questioning and that curiosity, and
Yeah.
that trying to put the energy into figuring it out always,
Mhm.
I don't want to say always, for the most part, will fall on the burden of the patient or the person that's life is affected, because
Yeah.
why wouldn't it? Like, logically, that makes sense.
Yes.
But I think that when you can have that shared burden a little bit, that's
Yeah.
what can help prevent some of that burnout for the patient, and maybe
Absolutely.
help prevent some barriers to care too. Because if it doesn't all fall on one side, then at least sharing that, you can go a little bit further when it's not as heavy on one person.
I
And
agree.
those consistent barriers, as we've talked with, we as G-PACT has talked with other experts, other people in just our space of rare disease, you see all these different things. I'm like, why is nobody talking to each other? Like, we all need to be friends. That's how
Yeah.
things get better.
I
And
agree.
the more conversations we've had, the more things have come out of it, more ideas have come out of it. Even for us, where I'm like, I didn't know patients wanted that information. Well, okay, so now we're going to work to get that information in front of our community.
Yeah. I think, you've hit the nail on the head for sure and we live in a time of unbelievable access to each other and to communication,
Yeah.
but, my my husband and I always have a giggle about this. So, my husband, is an astrophysicist. His books are all over the background if anyone's looking. So his field is quite different from mine, but specifically they
Mm.
have what's called an archive. So before anything gets published in a journal, anything you ever want published goes on a publicly accessible free website. It's a
Hmm.
database. It's massive, and it's free exchange of information. And nobody wants someone else to publish before them because that stinks, obviously. But it's available. Whereas in medicine, it is still a very oop, that's my intellectual property. Nothing
Mhm.
goes out until it's peer reviewed. And by the way, peer review is not a bad thing inherently. But when you have to pay $1,000 to submit to a journal, and then you have to pay to read the journal, then the exchange of information is much more limited, and
Yeah.
that's its own problem. So, I think the fact that more and more medical systems are using patient advisory boards, for example,
Mhm.
patient experts to lead questions in research specifically, that is a new way of using information that has never happened in history before, and it is
Yeah.
so important because if you're asking, politely, I'll call it irrelevant questions, to the life of the patient. That's important to know because also resources. I don't want to put my resources into something that no one actually wants. I want to know what
Yeah.
people care about.
Yeah.
And that's really important.
Yeah, it's very, the tides are changing a little bit. Too
Mhm.
slow for all of us. We want to speed
Yeah,
things
real
up
time
because we're
science is
sitting
never
here.
fast enough. Yeah.
No, but it's really nice to see that people are asking more from the patient. And, it does come down to that, oh, great, one more thing that we have to do, right? That
Yeah.
thought does
But
cross my
having
head
this
every once in a
say is
while.
different
But
than having,
yes,
like, it's not the
to
same
do
burden.
something.
Yeah.
Mhm. Yeah,
Yeah.
and I think that we've all wanted to be involved, right? We've
Hmm.
all wanted to be part of the system, part of the
Hmm.
change, especially when the things that are happening to you are directly impacting you and your patient community and
Hmm.
the people in your life. That's how I got into advocacy. I got thrown
Yeah.
into rare disease, and I looked around and I was like, "Wow, it is crazy in here.
Yep.
Like, what can I do?" And my
It's a
young
trip.
my young self was like, "I'm going to change the world. I can do these great things. Like, I'm going to do everything. Then
Yeah.
I got in here and I was like, man, it's exhausting. But, it's a good kind of exhausting, if you will, because
It
now people are
fires the other stuff.
realizing,
It keeps you
yes.
kinda yeah, for me, it makes sure that I don't burn out because I always have that little extra, oomph,
Hmm.
behind it all, and by the way, in fairness to my physician colleagues, like, there is a lot against us in terms of being able to take more time,
Yeah.
we're not even gonna get into the whole healthcare system insurance situation, so I never wanna
We'll
sound
be
like I'm
here all day.
throwing colleagues under the bus. We all get a choice in how we behave and how we treat
Hmm.
people, that I will not budge on, but having only 15 minutes to address a huge list of rare complications that we were not taught in medical school is not a fair
Yeah.
expectation either. So yeah, as you were saying before, the burden is unreasonably on patients and on family caregivers, but there are so many difficulties in so many directions, it's just not one-dimensional.
Yeah, and I love, the conversations that I've had with physicians to be able to hear, like, you at like, just leave your physician hat on, right? Like, take all the other hats off. Like, what is a barrier for you, right?
Yeah.
Like, what are you feeling? Like, how can we as patients come into, that 15-minute appointment that we all know is not long enough, but how do
Yeah.
we make the most out of that time? Like, what can we do that's easier for you?
Yeah.
Because I look at it this way, that if I'm doing something that's easier for you as the person treating me, in all reality, I'm making it easier for myself, right? Like, and it's
Yeah.
kind of one of those things where if I come in with my questions ready and, I've been tracking stuff and having those conversations, it's not going to make it come out as a perfect appointment,
Yeah.
there's so many other factors in there. But I started to realize the more that we, have these conversations with physicians and the more that we as the patient population understand the barriers that you guys are facing too, like they are real. Like
Yeah.
we're just frustrated because we don't feel good. And, you guys can be like, yeah, we understand that, but there's only so much that I can do. And there's, like you said, we
Right.
can't go down that road. We'd be here all day. But, it's just more of those open conversations are happening. And I love
Yeah.
that they're happening because
Me too.
physicians are more open to the conversations. Patients are more willing to have the conversations. And
Yeah.
like we said, it's nice and slow. But even in the last like 5 years or so, especially coming out of the pandemic and all of the, obstacles and the issues that we saw once that hit, and we're like, what can we do about this and how can we change these things? It really forced a lot of those conversations, which the pandemic was horrible, but some of the outcomes that came out of those conversations have been beneficial, and they also showed where the holes are so we can say, well, now that we're aware of this, what are we going to do about it? And I think
Yeah.
that that's a really strong place to start, and what in some ways got things moving in the right direction.
I agree, and it's such a huge topic, so it's hard to address all of. I'd love to address all of it, but just starting from the barriers that we face, as physicians in the room, when someone comes in, even if you're lucky and you're in a spot where a new patient complex appointment is 30, even 60 minutes, because that does
Mhm,
happen, even
mhm.
outside of private practices that that don't take insurance, it does happen. Prioritize what you're going in asking. So, it is completely reasonable as a patient to want it figured out. Um, for you, for sure. That is a very, very large ask when we do not know yet. And so much of like the, long COVID and MECFS, so many of these things are truly in the we don't know department, that what is
Yeah.
more valuable for your time and for the physician is to say, I'm coming in because this aspect of my quality of life is severely affected by this symptom. And it's okay if you have
Mhm,
700 other symptoms after that. And it's okay if you have a few in that question. But
mhm,
prioritizing it that way gives the physician, I'm sorry that the burden is on the patient this way. It really shouldn't be. But nevertheless, it gives the physician something to focus on in addition to the, yes, we do want to figure out what the problem is. We are trained to make
mhm.
a diagnosis and then treat it. But truly, that's almost never what I do. I do the upfront diagnosis. I do the HEDS evaluation. I can do your POTS evaluation, 10-minute stand test in the office. That's fine. The nuance is I can throw whatever medicine I want at you, but if you go home and you say, but I'm still having XYZ symptom, then that is what we need to address specifically. So starting it
Yeah.
like, and I truly recommend writing it down, not necessarily to hand a big long list to the physician. I don't know why my colleagues do not like being handed a list. I think it's fantastic because then I can skim it instead of ask all the questions, but not everyone agrees with me. But in any case, for your own sake, having a list in front of you because it's scary. You're sitting there trying to
Mhm.
remember all the things, and inevitably I will leave a doctor's office and forget the question I wanted answered.
Yeah.
Always.
Mhm.
It's awful. So if you write it down in advance, you're much less likely to have that happen, especially if you have someone else with the same copy in front of you. But for
Yeah.
my neurodivergent patients, and family members, my recommendation also includes writing down like what you are comfortable not, doing and not doing. So, sort of
Mm.
a pre-consent situation so that you're not in there just going, okay, that sounds fine, because it's not fine.
Been there, done that.
Exactly, exactly, and until you kind of get the language with that, you don't necessarily realize how common that experience is. So, if you
Yeah.
are unwilling to try a certain class of medications, and you can say why, but having it written down so that you don't accidentally, through nobody's, like, bad intentions, get pushed into doing something you were not wanting to do, because then it's your own time wasted, and that's awful.
Yeah.
That feels terrible as a patient. Um,
Yeah, especially if you waited like 6 months plus
yeah,
for that appointment, and
yeah,
you walk out of there and you're like, "What just happened?"
yeah,
Like,
yeah.
and again, that's not fun for you or for me, for anybody
No.
in that situation,
And I
and
do
it
genuinely believe that most physicians went into this with very good intentions, and unfortunately, in the
yeah.
chronic illness space, we know that that has not worked out well for a lot of my co-chronic patients, and
Mhm.
that's terrible to acknowledge and say, but it is true. But I do genuinely believe that we go into it with good intentions, and with that in mind, we can work as a partnership. And if we look at it as a
Mhm.
partnership, we're more likely to get where we want to go. And if you go in saying, here are my goals for the physician, it's a lot easier to understand as the physician what this person wants. I'll say on the flip side, one thing that happens all of the time, and I really wish that I could like put up a sign, or like a magic fairy like dust or whatever, to like as people come into the office, that they
Mhm.
can leave all of the trauma behind. That is a terrible ask. It's not going to happen. But what happens in the office is they come in and they're terrified, and they want to convince me of what's going on because that's what they've had
Yeah.
to do elsewhere. You don't
Yep.
need to do that with me. I promise I'm thinking analytically as well as empathetically. I'm not just saying, oh, no, you're here, so I should be, I should just give you what you want. No, that's inappropriate. That's bad magic, not magic, bad medicine. Same, same. But the stress and trauma that people come in with, um,
Yeah.
if the physician is not aware of and trauma informed in that area, it seems, um, not exactly pushy, but like, almost a little bit belligerent sometimes. And I
Mm.
know that that is not intentional at all, but it's sort of a, okay, we're gonna come in and we're gonna get what we need because finally my kid, and it's always about your kid, right? So I can
Yeah.
forgive almost anything if it's about your kid. But most physicians are not tuned in to what that other side of the lived experience is. And I still have those
Yeah.
memories of my mom with her tote bag with all of the medical records sitting there terrified that this was going to
Yeah.
be either, life changing or just just horribly heartbreaking. And it was
Yeah.
scary. So
Yeah.
I wish I could
I I
remove that for people.
Yeah, I couldn't agree with that more. And I think that's why even there's so many different pieces of like why conversations like this are so important. But I think that
Yeah.
that is definitely up there in the top issues and why that these are so important because that is a huge barrier to care right there.
Mhm.
Because if, you're butting heads of just something that is a simple misunderstanding of this larger issue, it really just slows down all of that care. It slows down the partnership. It slows down the communication. It can make a patient say, like, that's a bad physician. And a physician say, well, that's not that great of a patient. Or, oh, that patient's back again. Like, we all know we've been that patient to a physician at some point or another. Like, I own it. I know I can be a lot sometimes, but it's that thing where they come in now and they're sitting there like, I don't want to say the wrong thing. I don't want to say really anything at all.
Mhm.
When in reality, all it took was just a little bit more open communication and a little bit
Yeah.
more understanding. But I think again there's more of these, more and more conversations are happening and more patients are talking about it and more physicians are talking about it and being open about saying I don't know how to do this perfectly,
Mhm.
or I'm learning how to do this. And there are the younger physicians coming in and people going to medical school and everything are being taught now by people like yourself, other people with a very similar mindset that I think the new generation of doctors are going to be so different than the ones that like I first had,
Yeah.
with my first chronic condition going in and being like, my whole world just flipped, turned upside down, and I don't know what's going on and who I am. Like, what's a rare disease? What's a chronic illness? Like, what do you mean I'm on these pills for the rest of my life? What do you mean there's no cure? Like, what are
Yeah.
you talking about? What do you mean? And I think that there's going to be more conversation around some of the non-medical issues that these diseases and these chronic conditions really and how they can affect people, because that wasn't always talked about and
Mhm.
that wasn't always really acknowledged about how and where it affected you, whether it was on your social life, your mental health. Assumptions were made instead of conversations happening. So I just love these conversations so much. I say that all the time and I'm like, people are
Yeah.
probably like, Sam, learn new things to say. But it's true
No,
because
there's
they're just so
repetition.
wonderful.
Yeah. I agree, and one of the things that's particularly fun as a pediatrician is that I get to watch generations, and
Mm,
so, while there are still bullies, because there will always be bullies,
mm,
I do think that when I talk to my teenagers about what their school experience is like and what their friends are like, there is a remarkable, capacity for empathy and making space for each other where, my kids who have, POTS, for example, and faint unexpectedly or somewhat
mm.
expectantly, depending on the kid, their friends are right there ready to help. And they are,
So great.
ready to, grab the salt tabs. They know what to tell each other. Like they are there for each other in a way that, like, I had great friends growing up, but I'm not sure that any of those conversations would have happened even if we knew how. It just
Yeah.
wasn't done. And to
Mhm.
hear about the stories where they're saying, okay, well, I have my accommodations. The teachers aren't necessarily always, some of them are wonderful. I'm not painting everybody this way, but but my classmates, they know what to do. They're amazing. They'll like clear the space for me so I can lie down. Like, how is this happening? And it's incredible. So, not everyone, of course, but I think the fact that they were affected by the pandemic when they were as young people trying to learn and figure out a world that was awash with sudden misinformation and propaganda in a way
Mhm.
that, it's not that propaganda never existed before, but in a very new, very in your face way, they are suddenly able to look at the world very, very differently than adult counterparts. And I,
Yeah.
I mean, I don't know exactly how that's going to play out. The research is ongoing, obviously,
Mm.
but what I see is exciting and encouraging, and that's really, really
Yeah.
lovely. So, and I'm always,
Yeah.
like, talking to them about, like, "Don't believe, like, everything on TikTok. Some of TikTok's great." Because there are creators, I guess, like myself, I'm not on TikTok, just on Instagram right now, but, like, you don't wanna just believe everything, but they're very interested in learning how to assess, what's real and
Mhm.
what's not, which is why my niche, blew up so importantly because I'm both.
Mhm.
This is so many medical creators are out there right now saying, all right, well, it's kind of weird. We were not trained to be online like this. We were trained to be in our little ivory towers with our journals, and we like our journals and it's quiet there.
Mhm.
But instead we realize that, like, this is where the patients are. This is where the people are. So if you want them to understand their conditions and you want to be empathetic and understanding and you want that give and take of information, that is where we need to be. And it's a
Yeah.
little weird and uncomfortable, but it's super important to do.
Yeah, and I'm not on TikTok either. I'm a millennial. I watch my TikToks on Instagram.
Same.
I
They're like red, yeah.
it's but it's true that even just from our perspective as an organization, it's like, where do you find patients? Where do you meet patients? Like when I first got sick, it was like Facebook was around, Instagram was, like, barely a thing. You know, if
Exactly.
you scroll all the way down to your Instagram, you're like, "Wow, that's what I
I
was
was
posting
diagnosed in
back
the
then?"
time of MySpace, and that's uncomfortable.
Oh,
Yeah.
yeah. But and then I think it's that whole, if it's on the internet, it lasts forever and you see the memes like, "Well, then
Right.
where's my MySpace? Where are my photos?" I'm like, "Where are my
Yeah,
photos?"
and
But anyway.
my father, was, his degree was in artificial intelligence, so I grew up with, like, like, way early before it was cool, deep fear of what could stay on the internet
Yeah.
forever, so the fact that I'm doing this is very startling in the first place,
Yeah.
but hey, information's out there.
Yeah, and
Yeah.
it's one of those things where I think as an organization that we really wanted to do. I mean, we want to do a lot of things, right? We
Mhm.
we want to fix everything. We want everybody to feel comfortable. We want to
Yeah.
provide that support. But one of the biggest things that has always from the very beginning been part of the mission is to come to us, or if you come to us asking for education, if we don't have like the education, if we don't have it, we're going to go and find it. I'm not afraid to tell you that I
Yeah.
don't have the answer, but I will go talk to the smarter people to go find that answer for you, or
Yeah.
that the smarter
Perhaps just
resources,
more
right?
experience. They don't have, like,
Yeah.
it's always the
I
thing that
mean, it's one of those things
yeah,
where I'm like, I want people to be able to trust the information that we're giving them,
absolutely.
and because the information that we've always gotten, I look at things now, especially with AI, and I'm like, is that real?
Yeah.
That looks a little bit too good, or that seems a little bit too perfect. So
Trust your
now
instincts, yeah.
you've got those additional barriers of getting the proper information, or just the proper support, or just some sort of support to patients outside of all the misinformation. And it's really always been important since the very beginning of GPAC's inception, is that we really want to focus on being able to get you that information, that if you come to us, we've pre-vetted the information, or we're working on it, so that we will never intentionally, steer you in the wrong direction. I will, just like I would want my doctor to tell me, "You know what, I really don't know, but I will try to find out for you, or I will do
Mm.
what I can to get you that information."
Mhm.
I'm going to do the same thing, because nobody wants to just be told something. They don't just want information. We
Right.
want to understand the information. We want it in a way that makes sense to us. And we also want to make sure that anybody that comes to us, just like I imagine you feel the same way, like that they leave with a better understanding of when they came in, whether that's just saying they really cared about me and they're going to look that up, they're going to
Mhm.
find that out for me and get back to me, or I had this question when I walked in and I feel a lot better about that topic now because I got the right information. And you can't put a price on that. And I, hope that we can continue doing that just as an organization, because that's important to me as a patient. You don't ever want to steer somebody wrong. We know, especially since starting our food series, that as I talk about food and things that work for me, I'm like, don't get mad at me if this doesn't work for you. Like, this
Yeah.
is just something I want to share, that worked for me. It might work for you. We just want to give you information, give you ideas, give you some confidence, maybe a little bit of creativity,
Mhm.
along with the education to make those choices for yourself, because we can't fix everything, but we can do a little bit to make people feel more comfortable. And I think that's just, at least from my perspective, that's something that's really important that you don't get everywhere. So we want to make sure that people get that when they come from us,
Yeah,
or
and I
come
love
to
that, and
us.
that's part of why I think your organization is so great, and, there's a lot of, I think it takes someone who's really confident in their own knowledge to be able to comfortably say, "I don't know." When
Hmm.
I was in training, we were taught, like, to be really careful how we said that to patients because it looks like you don't know. I'm like, "Well, I don't know.
But I don't know.
What am I supposed to do?" So, and that was, like, that was a huge point of just difficulty for me as an individual, but as a patient, the physicians that I have, benefited from most and connected with most were very often not the most knowledgeable upfront, but the most willing to say, "I don't know about that. Let me go learn about it." But also,
Yeah.
like, from a physician standpoint, that's where the fun is. Like, doing the
Yeah.
same thing over and over and over again, like, "All right, you wanna replace me with AI? That's where you do it," you know? But if
Hmm.
you want me to figure out the nuances of the human body that we don't know yet and still treat it, That's fun. That's
Mhm.
that's, juicy for brains, like, that's the way I think anyways. So
Yeah.
I hate that there are so many barriers from a physician side, insurance, et cetera, that makes that hard and burdensome, and the burnout is so, so real. But also that's what feeds me, and that's what, as a
Mhm.
patient, I benefit from most. Someone who will say, "I don't know, let me go figure it out," because then I know
Mhm.
that I can trust that that person is really using their brain on my behalf,
Yep.
One of
Yep.
my best friends is facing a very specific surgery and had, tried to make an appointment. She still has the appointment with a certain specialist surgeon, and before she saw the surgeon messaged her and said, "I just wanna make sure that you're looking for this surgery because from your chart that you sent over, you might need that surgery, in which case you need to go to that person, not me." And she was so again, rare diseases, she was so stunned that someone would say, "I'm not the right person for you," but
That's
the power
huge.
and the humility and the self-awareness to say, "No, no, I'm not it. Go over there." That
Mhm.
actually increased my friend's trust in the first surgeon, a
Mhm.
hundredfold. And I think as physicians, if we are not trained to see and hear the benefit of that, self-awareness and again, humility, like, why would you necessarily realize? Because most of what I heard
Yeah.
in training was fake it till you make it. Like, that's a really
Yeah.
different message.
Yeah, I had, my last hospital stay, I
Mm,
had a hospitalist come in, and they're not always well-versed in all the chronic conditions. They've got
mhm.
a huge load of patients all day, and the doctor comes in, and we're having a conversation. He's like, "Yeah, that's not a thing." And I'm sitting here like, "But but
Mm,
it is a thing," and
yeah,
I'm, like, looking at my husband, and I'm looking, and I'm like, "I'm so lost." Like,
yeah,
I also was talking to another physician who's like, "It's part of their thing, and we're in agreement, so why are you" like, what? I was so
yeah,
frustrated and so confused, and this was just, like, a day or 2 into my admission where I knew that this hospitalist was going to be, my doctor for the rest of the
mhm,
week, and I'm like, well, that didn't go very well. Let's see how tomorrow goes. And I'm very unhappy the rest of the
yeah.
day, like very nervous. Like, is he going to take me seriously? And the next day he came back in and was like, so I went home, like he got me thinking. So I went home and I looked things up and I
Yeah.
did some research. And you know what? You were right. And I was like,
Ah, my soul,
and I'm
my
like,
heart.
what? What, like, and it wasn't even that
A
I was
little guilt.
right, right? It
Yeah,
it it wasn't like I needed that, but he was
yeah,
like, "Yeah, I was thinking about it and like things weren't
yeah.
making sense. So I went here and I went there and I came back. All right, so let's talk about it." And I'm just sitting there like, I actually don't know how to respond right now. Like I don't know how to how to
Yeah,
share, how do I what? And the
that's
rest of the
strange.
time
Yeah,
with him was wonderful. And I'm like, it that could have gone so many different ways because I knew when he was coming back in for
yeah,
rounds the next day, I was like, I'm on the defensive. Very similar to what you were
yeah,
talking about earlier, where I'm
yeah.
like, I'm ready to like
Okay.
I got the armor on, like, what do we gotta
Yeah,
do? And he comes
yeah,
in, he's like, yeah, like so I did this, and he sat down and he was so kind and
that's amazing.
so like just conversational and
Yeah.
interested at that
Oh,
point. And I'm
I love
like,
that for you. That's
I
amazing.
like this like, cause I was ready to hate him. I was so ready to hate him.
Yeah,
And when he left that first day, I just was like, I'm so mad. I'm so upset. And it's just, having something like that was a big moment for me, and I was in the hospital, so I'm a
yeah,
little, I'm feeling super, super vulnerable. I don't know how long I'm gonna be here. I'm really sick. We don't know what's going on.
yeah.
In some ways, some things are figured out. So much was up in the air, and I'm like, and I don't feel safe now. And then the next day it was like, just kidding. Like forget yesterday even happened, right? And it
Rewind.
just
Sorry about that. Yeah,
but
yeah,
that I don't know, or that feeling of like, for me anyway, because I can't speak for
yeah,
anybody but myself, but having somebody tell me like, I'm not sure, or like what you said of, are you sure that I'm what you're looking for? Because I think this
yeah,
person might be. You really do trust that person more because of the honesty. Because
yeah,
if I'm making a choice to put my life in your hands and you might not be sure and
mm.
you don't want to let me know that, no, please let me know that, because then I want to
I
know,
know.
like, maybe this isn't the relationship we think that it is.
Yeah,
And that's okay.
it
That's
is.
okay. I've
Yeah.
had a couple physicians early on in my diagnostic journey of, one of the first couple illnesses, as they started getting more complicated. She was
Mhm.
like, I love you. I've known you for a long time. You were too complicated for me now. Like, I don't
Yeah.
know. Like, I don't know what to do with you at this point without almost harming you because I don't know what the answer is. And I stopped seeing that physician after that. And no hard feelings though. Like I love her. She's wonderful. And that to me, she took care of me more in that moment than she would have if she kept me under her care. Because in that moment, she completely and utterly put my needs, my health above her ego. And that
Yeah.
was a big deal. And I think that that's something, again, that's a whole other conversation, but you start to see more of those things because there's just more communication happening.
Mhm.
I think because the physicians have demanded it and so have the patients. So
Mhm.
there's a nice thing happening and I just hope we can keep that ball rolling in the right direction as the years
Yeah.
go on.
I agree. I think, we are seeing so much more patient and caregiver advocacy than we ever have before, that it is
Mhm.
changing the way training is done, and that really
Yeah.
affects how we think as clinicians. So, it's very hard to change old systems, but the system we have in place was based on a a cocaine addict physician who stayed up 24 hours a day, and his residents literally weren't allowed to go home. Like, and we still use that system for training. And if we stop and
Yeah.
think about that, that's useful. But more importantly as well, we have spent the last several hundred years thinking in a very specific way on how education should be done. But now we have an explosion of information, and physicians simply cannot expect themselves to just know all of it. Most of us don't have brains that work that way. We are not computers. But we do need to know how to access that information and how to interpret that information and how to work with patients with new, evolving, constantly different, changing information. That's never been how we've been trained or taught before. So we have to roll with it. It's uncomfortable to do different things. Change is hard. But all the patient advocacy that goes into it, I think, is maybe the most important part of that.
Thank you so
Perfect.
much for joining me today. It was a wonderful conversation, and I really, again, appreciate your content and sharing with us today. So thank you so much.
Thank you. It's such a pleasure, and it's wonderful to watch what G-PACT does. I think there's so much impact that groups like these, and especially the way you run yours, can have on the patient population, not just for the conditions that you treat, but in changing the way we approach patient advocacy and information gathering. It's
Thank
it's just
you.
so important.
Thank you.
My pleasure.